My heart's beating so fast.
Digoxin works to increase heart contraction, cardiac output, and tissue perfusion. It decreases the ventricular rate and treats CHF and atrial fibrillation. Action. Hi, my name is Steph. I'm going to be your nurse today.
Hello,
Hi.
and I'm Stacy. I'm also the nurse.
Hi.
Can you tell me your name and date of birth?
Maria Alfers, 21494.
Great. I am going to scan your wristband. Boop. Okay, so I have an order for Digoxin for you.
What is that? I've never heard of it before.
So it also is called Digoxin at times. It's a cardiac glycosid, and it's used to treat atrial fib, which is your fast heartbeat that you came in with.
Oh yeah, I felt that. What is this pill gonna, or what is it gonna do to me?
So you might experience some anorexia, which is a lack of appetite, some nausea, maybe vomiting or diarrhea. There might be some abdominal pain, headache. If you have any blurred vision, or you might see some like halos, you'll want to let us know about that. Your vision could get a little yellow. There could be some dizziness, weakness, visual impairment, or some anxiety. So you'll want to let us know if you experience any of those side effects. Check your apical pulse, and that's actually going to be on your chest. And so I'm going to listen to that for a full minute. So you got to be quiet for it, okay?
Okay. I feel like my heart is gonna beat out of my chest.
Yeah, so your apical pulse was 120. It is higher than 60, so we are going to give you the medication. So I'm going to go get that, and we'll be right back. Patients may experience digoxin levels with concurrent use of quinidine, flecainidine, verapamil, and indomethacin. Loop diuretics, thiazide diuretics, and proton pump inhibitors increase the risk of digoxin toxicity. Antacids may reduce digoxin absorption along with large amounts of oatmeal. Hi, we're back again. I'm going to scan your wristband and your medication. So we have some digoxin here. What can you tell me about digoxin, Nurse Stacy?
We need to monitor their electrolyte and renal status. The therapeutic digoxin levels are 0.8 to 2.0, but the target levels are 0.5 to 1. We need to monitor the serum potassium levels and magnesium, calcium levels as well. There is a side effect of a yellow-green halo. It can be mistaken as glaucoma. And anorexia and bradycardia can be signs of digoxin toxicity.
So what happens if those levels get too high?
So some things to watch for are bradycardia. We've already talked about it, like the loss of appetite, vision changes. So if you see that halo around your vision, you definitely want to let us know. We'll be watching your potassium levels. So if you get some hypokalemia, which means that your potassium goes low, then we'll also be concerned about that. If the level gets too high, we can give you something or her something called Digibind. It's for a digoxin overdose. We're hoping that that does not happen, and we're going to closely monitor you. So we'll watch those levels closely and watch for signs of potential toxicity, and we'll keep your sister safe on this medication.
Is it a pill or a shot, or how do I take this medicine?
So this one we're going to put through your IV. And it's going to have an initial loading dose that we're going to give you right now. So the first 50% of that dose we're going to give you, and then we're going to give you 2 more doses, each in 25% increments over the next chunk of time. So you won't get it all at once. And so it will go through the IV that you already have.
And then when you go home, the medication will be a pill form. You'll take it on an empty stomach and take it at the same time every day. If you miss a dose, don't try to make it up. Just take it your normal time the next day. And don't take with any antacids or erectile dysfunctions, which you don't have a problem with that.
Oh yeah, I won't have a problem with erectile dysfunction.
Yeah, we don't think so either, but we do need to tell you, just in case.
And you'll want to make sure you don't stop taking the digoxin suddenly. And if you have any questions or concerns, reach out to your family doctor immediately if it's urgent.
The patient will be placed on a continuous cardiac monitor while hospitalized. After the loading doses are complete, the patient will discharge home and continue digoxin orally. Patient reteaching during the discharge process to reiterate safe administration practices at home.